Just, can you guys see me?
Yes.
You can see me now?
Yep.
Hi. Okay, wonderful. Um, yeah, we're sharing that. Okay, let's get started. Welcome. My name is Gina. Welcome to our workshop today on pathogens. I wish I could have a split screen so I can see you guys. Let me just check the layout. Bear with me. Nope, that's the layout I want. Okay, that's all right. I'm going to keep going because I don't want to, without any further ado, hold you up. Hopefully, maybe some of you will pop up and I can see your pictures as well. But welcome to our webinar today. We are going to go through what's called the triad of chaos, why women struggle, and what is the hidden connection between pathogen and hormonal chaos. If you guys can just
I got
mute,
it.
let's
Yeah,
see.
I'll go ahead and give it to the medical workers bureau.
All right, there we go. Participants. Everybody come on in and mute. Okay. Mute right when you come in, be great. All right. Let's go back to our screen share. Oh boy, I was really good at this last time we went through. Isn't that the way it always works? Okay, back. So if anyone can just mute when you're walking, when you come in, that'd be great. Here we go. What is the triad of chaos? We're going to go through today a very interactive webinar. And the reason it's interactive, we're going to see how serious you are about your health. We're going to find out how hidden inflammation is hijacking your hormones and where this hidden inflammation is actually coming from. We're going to do some assessments that's going to fully reveal what's going on with you and your health. We're going to look at and diagnose which gut pathogens might be at play, what's causing the inflammation that's completely hijacking all your hormones. So we're going to type in the chat for me, please. Does any of this sound familiar? Do you feel like you hit the age 35 and your body betrayed you? You suddenly began to feel exhausted, weight gain, mood swings. Despite doing everything right, you just things just went awry and didn't return. You're not alone. And it's not just aging, and it's not just weakness, and it's not just your willpower while you're gaining weight. The real culprit is that your hormones are under attack by a triad of chaos. 75% of women over the age of 35 struggle with hormone imbalance symptoms. 80% report that those symptoms are just getting worse. And 85% of those people are told when doctors look at their blood labs that everything looks normal. The truth is, the hormone disruption isn't you just getting older. It isn't just a hidden triad there's a hidden triad systematically destroying your endocrine system. We're going to discover what that is. So here's going to be the interactive part now. Type in the chat for me, which of these symptoms resonates with you most? Do you feel exhausted? No matter how much sleep you're getting, are you suffering exhaustion? Are you suffering with weight gain that you just can't get rid of? Is it coming in and around the middle of your belly? Are you experiencing PMS from hell? Are you experiencing mood cravings, mood swings with severe food cravings? Are you struggling with your head? Is your brain just fogged up? You eat and you have to go lay down because you can't think straight anymore? Are you suffering from a low libido, disconnected from your body? Go ahead and type in the chat. I'm going to come and look in the chat. What symptoms, which is your symptom? Go ahead and type that right in that chat there. Let's see, what do we got here? You said we got, yes, Jessica, good. Thank you for saying you can hear me. Any of those symptoms resonate with any of you guys? Go ahead and type that in the chat. Welcome to every one of you. Let's see. See, inflammation, good. Go ahead, anything else? Is a yes to all three of those things? All right, let me get out of that chat. Back to the presentation. That's it. Won't be able to run back and forth to the chat, I don't think. I guess I have to master this Zoom. I'm sorry, it's crazy. Let's see, where are we? You know what they did? They updated Zoom and they made it really fancy and seems a little over my head now, this Zoom. I'm gonna have to really get proficient with it. There we are. Okay, back in business. Thank you for being patient. So we got a lot of kind of a combination, but of symptoms. Every single one of these symptoms is going to point to really the problem that you're having, what is really causing it. So let's get into what this hidden triad is and what your doctor never told you. Your symptoms form a pattern, and we're going to discover this pattern in about 20 minutes when we go through some interactive assessments here in this webinar. But what's happening here is that you start to develop gut dysfunction, right? We go back to that area when it started. When the gut is not functioning optimal, pathogens get in, and they get in and they start to create systemic inflammation. They cause chronic low-grade inflammation, not like you broke your foot and it's all swollen. No, it's constant and chronic. It's kind of the more dangerous kind, and it blocks your hormone receptors and your ability to produce those hormones. Hormones get hijacked. And this creates more gut dysfunction, which keeps you in this cycle of gut dysfunction, dysfunction in the hormones, poor insulin resistance, inflammation, and you go around and around. You can't fix your hormones without fixing your gut. You can't just throw on HRT without fixing your gut and have it be optimal. So again, interactive. We're going to type in the chat again. What triggered your triad of chaos? Go ahead and type that in the chat. Think back to when you started to fail in your health. Was it birth control or were you put on doses of antibiotics? Did you start to just notice that you had some digestive issues? All of a sudden you eat, you're getting bloated, constipated, onset of food sensitivities. Are you having persistent chronic symptoms of fatigue, joint pain? Has autoimmune conditions have popped up in your diagnoses? Was there some emotional trauma? Did you find yourself in a toxic relationship or become a caregiver and really stress went off the charts? Or were you exposed to toxins? Did you move into an apartment or an office where there was mold? Were you subject to chemicals, environmental triggers? If any of these apply to you, go ahead and type that in the chat. Okay, I figured it out. I can see the chat without making a big scene about it. But go ahead, come on, guys, interactive. That's really okay. After surgery, good. Okay, after some issues, food poisoning, good. Raw sushi, that'll do it. Boy, oh boy, do they invite those pathogens in. Good job, guys. Thank you for being interactive. It makes it more fun for all of us. So we're going to kind of recap here how this happens. How does this cascade destroy those hormones? So we're going to remember that trigger and event that you guys just put in the chat, because that's what we do in functional medicine. We're not just looking at what happened today or what happened yesterday or last week. We're going to look kind of back. When did this really start? What was the trigger? So we find that trigger event. Often it's antibiotics, stress, toxins, trauma. All of these things create gut dysfunction. This interruption in the hormones, specifically insulin resistance at the onset, causes your gut barrier to break down. You start to have a leaky gut. Then with this leaky gut, it becomes very toxic. Those pathogens start to overgrow, induces chronic inflammation into your immune system, goes on high alert. This disrupts your ability to make hormones. Your receptors get blocked. You can't produce them. They're also in there eating all the things that needed for hormones to be produced, like your iron and your B12 and your magnesium. And this is continues to just kind of grow, 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 and your symptoms just go out of control until you're exhausted all the time. You've gained 50 pounds, you have mood issues, you just feel terrible. Your body is stuck in this inflammatory cycle. And conventional medicine is only going to treat the symptoms. It's not going to fix it like functional medicine, where we identify that trigger and then really figure out what is the pathogen or pathogens most likely causing you problems. So, your body's going to talk to you all the time. If we are quiet and listen to our body, it'll tell us where we have issues. So, again, interactive, type in the chat, where do you feel it the most? Do you feel most in the head? Are you having brain fog? Are you suffering from headaches, mood swings? You feeling it in your chest? Is there anxiety, palpitations? You're starting to have breathing issues? Is it in your abdomen? Do you feel bloated? Are you having stomach pain? Do you have weight gain? Is it in your pelvis? Are you suffering with period problems, bladder issues, low libido? Or it is in your joints and your muscles? Do you notice a progressive onset of aches and stiffness? Are you having autoimmune systems, psoriasis? Have you been diagnosed with autoimmune disease? Go ahead and type that in the chat, guys. Let's see what we got. I'm going to look at that chat. Here we go. Yes, excessive weight loss, weight gain, anxiety, head, multiple, right? A lot of us do. We'll get it. All of the above, multiple. You guys are awesome. Wonderful. Yep. Often it is multiple because it often is not just one, but many infections going on at the same time. Once the system breaks down, it just opens the gate for everything to come on in. Your body's going to show you exactly where the inflammation is hitting you hardest, and there you've kind of discovered it. So let me recap this inflammation hormone hijack cascade that most doctors miss. You have this triggering event. Things happen here, and boom, my health just started to go south. The reason was the triggering event created tremendous stress on the body, which created the insulin resistance. When you have insulin resistance, inflammation blocks the receptors and you start to gain weight and have sugar cravings. This leads to a thyroid suppression. You have a cytokine or an inflammation response that suppresses the function of the thyroid, causing you to have fatigue and metabolism crashes. This leads to more stress in the body, which elevates the cortisol. So when we say hormones, we're talking insulin, cortisol, thyroid hormones. It's not just your sex hormones or, your estrogen or your progesterone or your testosterone that we're talking about. We're talking about, there's a lot of hormones in the body that make you feel healthy. So when the thyroid is suppressed, you have an elevation in cortisol, which creates more stress on the body, which then you're in a state of chronic inflammation and you're no longer producing progesterone, which is going to be your balance for estrogen, males and females. You become estrogen dominant, where you have that funny weight gain pattern. Men will get a little more hippie, maybe their breast tissue will grow. Women also will have that specific body type of weight gain in the hips, around the belly and the hips, and just doesn't move, it doesn't budge, then you're suffering with estrogen dominance because the estrogen has blocked your detox pathway. So even if you try to lose weight and burn it off, you can't shed it because all the detox pathways are blocked. You have this buildup in estrogen and it's going to cause symptoms for sure. The result is you're going to feel like a stranger in your body. And even though everyone says, oh, those labs look completely normal, and you're like, well, why do I feel so bad? So it all comes down to the gut. Everything in our health is going to come back to the gut. And in functional medicine, that's the number one thing we fix. Because if we can fix your gut, your hormones are now functioning, thriving, and you are a happy person. You're enjoying your food, it's moving through your body correctly, and you're absorbing the nutrients that you need, and you're making the hormones that you need, and life is good. So let me know, how is your gut health? Interactive time. Are you a number one? Are you having constant issues? Are you having bloating, pain, irregular bowel movements? Type in the chat again. Let's see you guys in there. All right. Good. Number two, are you a number two? Is it inconsistent? Do you sometimes feel okay, sometimes not so bad, but you know that there's a problem that you need to correct now, sooner than later? Or are you a number three? You're completely healthy. You have regular bowel movements, digestion is comfortable, you can eat whatever you want. Let's see what you guys are. I want to see how serious you are. Is it one, two, or three? Okay. Okay. Good. Yeah. Yeah. All these things are related, guys. The things that you're putting in the chats, autoimmune diseases, insulin resistance. Yeah. Number ones, if what else? Come on, let's see some numbers if you can. I know you're probably sometimes doing other things, but yep, we got couple of number ones, constant issues. That's most of us on this call is going to have constant issues. That's what brought you here in the first place, no doubt. If you scored a one or a two, your gut dysfunction is likely driving your hormone problems. And when this is compromised, it becomes a breeding ground for the hormone hijacking pathogens. So, what are these hormone hijacking pathogens? What is this pathogen problem? I never heard about this. Well, let's get into it now. The reason you have never heard about it before, probably, or it's a brand new idea. The Nobel Prize was issued in just 2015 for the person who discovered this. Then they discovered the medicine ivermectin. We don't go that route. We like to fix things in functional medicine from the ground up to just really tear down the bad stuff and build up the good stuff. But that was a beautiful Nobel Prize. And so it's just in 2015. So just 10 years ago, we have really realized that pathogen infections are really causing us a big problem because you have a gut dysfunction, pathogen overgrowth begins. These pathogens release toxins, which are inflammatory compounds flooding your system, causes chronic inflammation, blocking your hormone receptors, and you can't make those hormones anymore, which creates a loop of more gut dysfunction. So the most common hormone hijacking pathogens, we're going to list four of them. Number one, Candida. This one we do see on your blood work often. Um, Candida feeds on estrogen. So even males and females both need estrogen, obviously females more, but it's going to feed on that estrogen and it's going to create you an estrogen dominance. And then it's actually going to spit out analogs that mimic estrogen. Second pathogen is a SIBO, small intestine bacterial overgrowth. SIBO produces very inflammatory endotoxins. The small intestine really is supposed to be almost sterile, like really clean in there. It shouldn't have any bacteria at all at that point. The point that the food and the nutrients get into that small intestine should be very clean so that we're just absorbing those nutrients. Number three, parasites. Ugh. Parasites steal your nutrients for hormone production. Parasites are going to latch onto your intestines and they are going to ingest all your iron, all your B vitamins, and all your magnesium. Then finally, we have H. pylori, which disrupts your stomach acid and it affects your ability to absorb nutrients. Let's get a little deeper into hijacker number one. Hijacker number one is Candida, or we know known as the estrogen beater. How does it destroy your hormones? It actually has in it, Candida, estrogen receptors to feed on those hormones. Produces a toxic byproduct that inflames your reproductive organs, right? So fertility problems very well may be a problem with Candida. It's going to block your liver detox pathways, and it's going to thrive on sugar, creating unstoppable cravings. So those days that you are just stuffing that sugar, you can't get enough sugar in your mouth, more than likely is your Candida kind of screaming out to be fed. The result when you have Candida is you're going to have heavier than normal periods, severe PMS, breast tenderness at every age, male and female, weight gain around the hips and thighs, male and female, severe sugar cravings, recurrent yeast infections, recurrent UTI infections in the elderly, and you'll see a white coating on your tongue. It's very hard to eliminate candida because it forms protective biofilms that become resistant to just standard antifungals. There's got to be a very systematic way in stripping these and getting rid of them. Hijacker number two, SIBO, small intestine bacterial overgrowth, also known as the endotoxin producers. How do they destroy your hormones? They release inflammatory lipopolysaccharides into your bloodstream. These lipopolysaccharides directly suppress your thyroid production. This creates insulin resistance, blood sugar chaos, and it produces a methane gas which slows your metabolism. But in addition to that, it blows the belly up so the person looks and feels like they're about 6 months pregnant. So that person that you went up to and asked, when's the baby due, and said that they weren't pregnant, you only probably do that once or twice in your life, probably as of a severe SIBO infection. The result is going to be extreme fatigue, unexplained weight gain, brain fog, bloating after meals, metabolic dysfunction. It's hard to eliminate the SIBO because it hides in that small intestines where most treatments don't reach effectively. Hijacker number three. I apologize in advance for the very gross picture there, but that is literally what the toilet bowl looks like when you get on these parasite cleanses and start to free yourself up of these nutrient thieves. It's crazy. And it's going to go on. It can go on for up to 3 months or longer, depending how infected you are. They destroy your hormones because they steal all your B vitamins, especially magnesium and your iron. They release ammonia, which damages the reproductive tissues. Also, is it infertility or is it parasites? Triggers your autoimmune response against your thyroid and your ovaries, so your body starts attacking itself. And it's going to severely disrupt your sleep cycles with feeding patterns. So this isn't a planned interaction, but back in the chat, guys, just type in there for me. Does any one of you wake up between 2 and 4 a.m. most nights? Just type a yes or a no there in the chat. Are you waking up? Yes. Yep. Between 2 and 4 every night. What's happening here is these parasites are actually feeding. They're most active between 2 and 4 a.m. when you're sleeping. And the result of this is nutrient deficiency induced crashes. You can't make it through the day with energy. You can't focus. You have unexplained fatigue. You think to yourself, why am I so tired all the time? I used to be able to do this, this, and this. Now I can't do a quarter of that. These are responsible for your hair loss, right? So those people that you love, all of a sudden you start to see they're losing their hair, females especially. And, this is a big, big culprit of hair loss. Also causes irregular cycles and causes autoimmune thyroid disease. So you get an infection of parasites, you now have probably 2 or 3 pharmaceutical medications given to you to correct this. And in all defense of medicine 2.0, the pharmaceuticals, they will correct it. Unfortunately, they cause other problems. Medicine 3.0, functional medicine, we correct it without causing other problems because we go from the bottom up. Parasites are hard to eliminate because they are masters at hiding. They have mastered their life cycles so that their larvae, they will go and hide in places that you can't get to, like in your lungs and different spots and then they become mature and they move back into the intestines. They have complex life cycles, so it requires precise timing to really eradicate it. It can't be done in like a week or a 10-day cleanse. This takes time to eradicate all of them. And I can tell you, I'm on probably week 8, and I'm still seeing this every day, sometimes worse than that. Hijacker number 4, H. pylori, the acid blocker. This one is really got my attention because this now, since they have discovered, is most probably the cause of stomach cancer. My father passed away of stomach cancer, and I am certain he had H. pylori. This could have been avoided. How does it destroy your hormones? It destroys the stomach acid needed for nutrient absorption. It blocks your B12, iron, zinc, which are critical for hormones. They love those three to just feed on and disrupt. Creates chronic inflammation in your digestive tract. You have a real stomach ache, acid reflux, and it disrupts your protein digestion because you don't have enough acid in your stomach anymore to break it down. So you have these partially digested protein chains running around your system, causing more grief. The result? Malnutrition-induced deficiencies, B12 anemia, low stomach acid and heartburn, acid reflux, difficulty building muscle, right? You start to just lose muscle and get skinnier. And they're really hard to eliminate because they burrow deep in the stomach lining and they create an alkaline pocket that protects itself. Which hijacker do you think might be affecting you? Is it candida? Are you having cravings, PMS, and estrogen dominance? Do you think you might have SIBO? Are you bloating after meals, fatigue, brain fog, weight gain, just have to go lie down after you eat? Do you think it's parasites, unexplained fatigue, digestive issues, nutrient deficiencies unexplained? Or is it H. pylori? Do you suffer with heartburn, stomach pain, B12 deficiency, protein, digestion issues? Or is it multiple? Do you think you have a little bit of a combination of all of these? Go ahead and type it in the chat. A, B, C, or D. Where are we at? While you guys are typing in the chat, just want to one problem that we have in what I see as medicine 2.0 is that we start to the doctors, oh, you go in, you're having stomach pain, you're having reflux, immediately they'll give you a PPI, proton pump inhibitor, omeprazole, or one of these antacids, or you're taking antacids, or you're drinking sodium bicarbonate to try and calm that down or mask it. It's really the opposite of what needs to happen. The stomach acid needs to be at about 1.0 to 2.0. If you have H. pylori, that raises your stomach acid already to just 4 or 5. If you take a proton pump inhibitor on top of that, your stomach acid is even going higher. The stomach needs the acid to be at 1 to 2 on the scale in order for that valve to close. So the food gets in, it's got a good amount of acid in there, valve closes, that acid is high enough to break the food down properly so you can absorb the nutrients from it. As soon as you take an antacid and you raise that the chemistry in your stomach, the acidity, well, it's too high and it's not high enough to close that pump. So you're refluxing and you're damaging your tissue. You're just not feeling it anymore. Not a good scenario. So let's see. Anybody have any idea what they might have going on in here? Multiple? Okay, thank you, Betsy. Okay. Most women need comprehensive pathogen elimination. Most of us don't come to the table with just one infection, unfortunately. This is the invisible invasion. 75% of women with hormone imbalances have undiagnosed gut infections that creates chronic inflammation. These pathogens aren't just causing digestive symptoms, they're systematically hijacking your hormones and making the whole body system worse through inflammation. The medical blind spot that your doctor missed, and I won't spend a lot of time on this, is that in Medicine 2.0, we look at things very segmentally. So if you go to the gynecologist is going to focus on your hormones. You go to your gastroenterologist, the gastroenterologist is going to look only at your gut symptoms. And your primary care is going to look at your blood work, which probably looks normal, and it's going to say, well, everything looks okay to me. Just, let's monitor. Meanwhile, you leave left feeling terrible. The problem is that they never tested for a comprehensive gut pathogen analysis. They looked at your blood work with different eyes. They're not really scrutinizing your blood work for inflammatory levels or scrutinizing your blood work for hormone metabolites and the ratios. So they never really arrive at the root cause connection between all three systems. So doctors are like trying to solve a puzzle, but they're only looking at one piece. So I just want to let you know that you're not crazy. It's not weakness that you've gained weight. It's not a lack of willpower. You're not just getting older because in every age we can clear this stuff up and feel better. So type into the chat number 1, 2, 3, or 4. Our doctors does any of this resonate with you? Doctors don't take your symptoms seriously. Or you've been dismissed when you're describing how terrible you feel. Or are you told that your labs are normal, but you still feel awful? Or are you losing your mind because no one's understanding? Or is it everything? Go ahead, type that in the chat if you can, if it's not too much trouble. Interactive, I want to see multiple, all good. Thank you guys for being awesome team players. Yeah, a lot of us have all of these, and those symptoms, they are real. This triad of chaos is absolutely real, and there is a solution. We're going to move to the solution segment of our webinar now, and what we're going to introduce to you is something called the Thrive 9 app assessment. Now, you can get it two ways. You can either bring your phone to the QR code and get it, 123, or if that's a problem, you can type in there Gina's physical health .thrive9.life, and you can get it that way. We're going to measure those hormone balances now. So just give me a thumbs up in the chat if you're good, if you guys are okay to and you get that app. I'm just gonna I'll flip back here in a sec, but what? Um, we're gonna take our assessments now. So we're gonna complete the Thrive 9 life assessments just in a second because I'm gonna make sure that you're all set up. Takes about 5 minutes to complete. You can just type in your browser genusphysicalhealth.thrive9.life. And we're going to complete the hormone assessment. Make sure when you set up your account, you're going to set up that you click your sex if you're a male or female. So here's what it looks like when you get to it. And you're going to scroll down and go to where it says sign up. Just give me a thumbs up, guys. Tell me know if you're okay with the Thrive 9 app assessment. Do you have it? Do you have any issues getting it? Let's see. Jessica, Munchado, Betsy, are you guys all okay? Are you working on getting that app? Okay, so the website is I'm going to actually type it right here. Maybe this can help. See if you can just copy that or click on that. genusphysicalhealth.thrive9.life. I'm just going to pause here, no rush. Let me know when you all have it because this is a really fun, interactive part of the webinar. Go ahead and sign up to account. I'll just pause here, make sure everybody has what they need. I know some people, I think maybe, have taken it earlier. Are we there? Is everybody there? Jessica, are you okay? Go ahead and just type in there, okay. I don't want to change my layout. Okay. Okay, Jessica, thank you. Thank you. Okay, wonderful. So you're going to sign up. You can either sign in with your Google or you just can, sign up, but make sure you click your sex, male or female. And then we're going to jump right to the hormones, women's hormones or men's assessment health. You'll see over here if you're a man on the call. And we're going to jump right into that. And we're going to take that assessment now. So I'm going to just give you guys just a little bit of time. It could take up to 5 minutes. I'm going to open up the chat again in case anyone's running into problems. I'm here for you. But for now, just about, 3 or 4 or 5 minutes, I'm going to go ahead and take that assessment. I'll be quiet and I'll put maybe some. And then when you're done, what you're going to do when you finish your assessment and you get your score, up here is going to be your global score. And these components that are going to show up that we break down, they're also going to be clues for us. But for the purpose of this webinar right now, we're just going to put in the chat what is your global score for your hormone assessment. Thank you, Betsy. Good. Yes, Jessica, you have to complete that profile because it wants to know your name and your sex. You should be able to do that. It shouldn't take long. How we doing? Okay, Jessica, that's okay. Um, you don't have to upload a picture. Were you able to take the assessment, Jessica? What about can you do it on your phone? Did you try getting in the assessment on your phone? It's a little harder if you're trying to do this on the computer. It's a lot easier to do it on the telephone. And Jessica, will you be able to try it on the telephone? Beautiful. Yeah, we have a few minutes. Take your time. I'm glad you're in. Just make sure you put that you're a female or male, whichever sex is your correct sex. Okay, couple more minutes. Once everybody's done, just pop your score, your global score in the chat. Where did we go? Where'd you guys go? Hmm. Seems like we failed our screen share. What? What's happening here? Okay, I am having trouble with this screen share. Let's try again. Share. There we go. Okay, back in business. Okay. All right, guys. Good job. So if you had any trouble with that, we can fix that. Okay. I don't know. I gotta get better at this Zoom. I apologize. Let me get this in the play from presenter's view and continue to share. Getting back to where we were, guys. And we're gonna move on. Good. Okay, here we are. So that global score is in there. Let's move on. We're going to complete this. There is a solution for this. So we're going to break this triad by, it's going to require us to do 3 assessments. Today we did the hormone assessment. Men who are on the call did the hormones, the men's. These are specific hormone imbalances that are going to show up, your estrogen dominance patterns, and thyroid and adrenal dysfunction. We still need to look at to fix the whole triad. We need 2 other assessments. Your inflammation assessment, which is your current inflammatory damage, stress response and dysfunction, and your energy metabolic disruption. We also want to look at your gut pathogen assessment, hormone hijacking, which pathogens are really causing the most chaos, causing inflammation, biofilm resistance patterns. We can't just solve this problem with just one. We need to look at everything. So why does this matter? Why does this actually matter to you? Is it possible for you to feel better? I just want you to close your eyes now for a minute and just imagine that the number one problem that you're having right now with your health is completely gone and that you feel good. I've worked with women who have been dismissed, gaslighted, told their symptoms are normal, but we know they're not. So we reject that narrative. We know that your body talks to you, and your symptoms is your body's cries for help, not just your character flaw. You're just not looking for attention. We know this. Things are wrong. So if you can wave a magic wand and have your health back or have the best life for yourself, what would that be? Would you want stable energy throughout the day? What's the number one for you? You can put a few, but put the number one and then more. You're looking to lose weight? Are you having stubborn weight in the middle? Are you wanting more mental clarity? You want to stay sharp and emotionally balanced throughout the day? Do you want easier cycles? Or you want to feel vibrant? You want to feel confident in your body again? Go ahead and type that in the chat, and I'm not going to come off the screen again because every time I leave, I come back to a loop. Anyway, go ahead and type that in the chat. What are you looking to try to correct? What do you want most out of life or correction to your health? You're looking for stable energy, mental clarity, easier periods. You want to feel vibrant again. What possibilities are there for you in this? What are you looking for? Come on, guys, don't leave me hanging. Interact. What do you want? What do you want out of life? I tell you me, I wanted stable energy. I wanted to lose weight. I wanted mental clarity. I wanted to feel vibrant again. I wanted all of these things to kind of happen for me. And I can tell you it is happening. So it's all good. Good to see you guys. I got your cameras now. I can see your names over here and your faces. Hi, Jessica. Very nice to meet you. Thanks for turning the camera on. So go ahead, type that in the chat. What do you want for yourself? Huh? It's okay to dream. Okay, just think of it. These possibilities are there. It's not just it's possible. It's probable that as soon as you address all three parts of your triad of chaos, hijacking your hormones, that the things that you're looking for to happen in your life are going to start happening. You're going to get that energy. You're going to be sleeping better. You're going to be losing weight. You're going to feel some energy. Your mind's going to clear up. It's just amazing how Medical 2.0 lets us run around feeling so horrible and telling us we're good. The way we fix it is through a complete gut inflammation hormone reset. It's a 6-month program that we're going to offer you to restore all of this. In the first month, we're going to really dive deep and get assessment baselines that give us clues of what really you're dealing with probably the most. It's going to be comprehensive assessments. We're going to map your pathogens. We're going to find some ways to relieve the stress, try to start to control the inflammation, and try to replenish the micronutrients that have been stolen. In month 2, we're going to pull out the fire extinguisher. We're going to try to get rid of the acute inflammation, start to repair your gut barrier, and start to rebalance your stress in your cortisol levels. Month 3, we get to work. We roll up our sleeves and we get on the protocols to start eliminating the pathogens, and you will probably see them in your toilet bowl within 2 or 3 days of starting the protocol. With targeted elimination of the parasites or the fungi using antimicrobials for bacterial rebalancing. And then you're going to start to feel a whole lot better. And that takes us to month 4 through 6, which we're going to really hold your hand through. It's going to be the restoration period. In the month 4, we're going to start to restore your hormones. We're going to optimize the balance. We're going to get that liver detoxed. And we're going to get your thyroid and adrenal glands functioning well again. Then come to month 5, we're going to start to rebuild the microbiome so those pathogens are not welcome and are stopped right at the gate before when they hit the stomach, they're killed off. The way we do it is by restoring the beneficial flora, healing your gut line, and eliminating some of your food sensitivities. In month 6, we integrate and prevent. And for long-term wellness, those protocols are going to be in place for sustained stress and resilience. The complete triad restoration from the ground up is what we're going to perform. Now, what is the difference? Some people might say, what difference is if I take a whole bunch of pharmaceuticals or I need to take a whole bunch of nutraceuticals or supplements to get rid of this? The difference is the nutraceuticals and supplements, they don't have side effects where they're going to destroy other things while they're fixing one thing and destroying another. And the second thing is they're temporary, right? So you may need to take while we're going through this, you may need to take a bunch of supplements to clear yourself out, but it's temporary. Once you're cleared out, then you're just going to stay on some baseline supplements. So let me just recap what you're going to get: a complete support system. You're going to get the 6-month restoration program. You get your assessments. You're going to get all 3 comprehensive assessments plus 3 bonus assessments. You're going to get custom supplement protocols. We're not just going to throw everything at you. And in your Thrive app, you may have seen that it recommended protocol supplements at the bottom. Don't get overwhelmed by that because we need 2 other pieces of the puzzle to see what are the best supplements for you. For sure, the Wellness Foundation pack is just customarily good. Excellent. And we only use supplements that come from third-party tested labs. So a lab outside the company that makes them is testing them and certifying, yes, these are clean, these have no added toxins. It's just really this gold standard for supplementation, and that's all we use. You're also going to have monthly progress reviews, right? Because you have that app. Now you can check yourself. Every month, we're going to encourage you to look and see how we're doing. And it'll be phase by phase elimination guides. You'll be supported with education. You'll be supported in our private app. You'll be supported in our monthly group coaching calls. You'll be supported in our weekly live education seminars. You'll have access to 72 training videos. Don't let that overwhelm you. But for this 6-month program, that restoration program, you will get in your email 3 videos a week, like a Monday, Wednesday, Friday, 5-minute videos that are just really going to kind of like virtually grab you by the hand and tell you do this, do this, do this, do this. And then you'll have 24-hour support. And for all of this, $99 a month subscription. This is the cheapest, the least expensive, state-of-the-art, gold standard functional medicine program and protocol that you will ever encounter. My team put together what a program for you to solve major problems, help live a much longer, healthier health span of life for just $99 a month. You know, everyone says functional medicine is so expensive. They've made it possible for you to have a subscription investment at $99 a month to get the health that you're looking for. So how ready are you to break free from this cycle? Go ahead and type that in the chat. Are you ready? Are you ready? Are you desperate? Are you not sure? Are you still leery? Are you not serious about your health? Are you very serious about your health? What's your readiness score? Are you ready to connect and really, really tackle the problem that you're having? How ready are you to help yourself? Good. I hope you're all ready, because what a difference. A lot of people will say that they would pay anything that they can to get their health back. We take our health for granted. And if we can really boost our health span, this is just the way to do it. So because you stayed to the end and you get on this live webinar special with exclusive bonus for today's attendees, first month is only going to cost you $47. So for $47 to start, you're going to immediately get started and you're going to be on the path to health. What you're going to get immediately is the hormones assessment analysis for men. You'll get the men's version. You're going to get the gut pathogen assessment analysis, full access to the 6-month program app and the community, onboarding call, private channel with a VIP app support where you'll have access to all of our workshops as we go through them. Stress workshop, about 4 or 5 different workshops, sleep workshops, all the things to help improve your health. And you'll have monthly group calls. And you can cancel this at any time. There's no obligation, there's no contract. We're so sure that you will get so much value out of this that you won't cancel, that we offer you cancel at any time. Go through quickly just this case study, which could be actually myself. She was Debbie, 50 years old, business owner, uh, just a mess. Inflammation score of 68, which is pretty high, critical, exhausted by 2 o'clock daily, gained 50 pounds, PMS, severe brain fog, but her labs look perfectly normal. She got in, she had some pathogens that we had to clear up. Her inflammation score dropped. She's developed sustained energy. She's down 22 pounds, which is such a great feeling. Pain-free cycle, stable moods, all her biomarkers back in optimal ranges. The ranges that we see on the blood work in medicine 2.0 are different from functional medicine 3.0 optimal ranges so that we know you're feeling good. Her problem and my problem was parasites, candida, and SIBO, estrogen dominance. So what happens if you don't do anything? Is it like, it's like, what's the cost of waiting? What's going to happen if you don't do anything to address these pathogens? Inflammation is not going to get any better. It's just going to get worse and accumulate in your organs, creating other problems. Pathogens are going to multiply. They are strong. They'll form stronger biofilms and get even smarter and stronger and take over more. Your hormones are going to continue to be disrupted. Your symptoms are just going to get worse. Your life vitality is going to decline until it continues to drop. So it doesn't improve on its own. It just accelerates, right? The parasites, if you have on our app, on our assessments, when we get to them, if you have high gut and high hormone scores, you've got worms or parasites. Nasty. If you're kind of moderate on everything, yeast is probably taking over the entire system. If you are sky high with your gut score, bacteria is in your small intestine. And if you have high inflammation and exhaustion markers, you more than likely have hidden viruses in your system like Epstein-Barr or similar viruses. Um, it's really that simple. Clear these things up and health comes back. It baffles me. So how is important is it for you to move through this to the face, to confront your health fully and really go for just a healthy life, to feel good again? How important is it? Go ahead, 10, 9, 8. How much do you want this? How bad do you want to get better? I say 10. Yeah. We want our health, right? I want you to be healthy, but obviously I can't want that more than you. I want you not to have cancer. I want you not to have the things that ankylosing spondylitis, psoriatic arthritis. I don't want you to have any of those things. If we can avoid that, I'm here to tell you it can be avoided, and that's what I want for you. So I hope you want that for yourself. All right. I know you're ready. Nines and tens show the energy of people who refuse to settle for feeling terrible. I hope you refuse. You can secure this transformation and get started today for only $47. You're going to get your complete hormone and gut assessments, the full triad analysis report. You can cancel this subscription at any time. 6-month full program. By the end of the 6 months, your life will be completely different than what it is today. I promise you that. $99 a month from month two. You get all 3 assessments, complete analysis, the bonus assessments, month by month restoration protocols. direct private channel support, community access, weekly group calls and training, and just a fascinating amount of information that's going to really keep you excited in your mind. So that's just about getting to the end of our program. So if you would like to take action now, your triad of chaos can end today. So what you can do, you can either click this link down here that will get you right to that payment link. So once you write in, you're going to get immediately sent confirmations. You'll be open to the course and you'll get my calendar link to book a one-on-one call. So don't let another day pass feeling terrible when the solution really is right here. Clear this up. A lot of things clear up with it. So you can use that QR code or you can just go ahead and click on this link or copy the link. And yeah, if you want, I'll open it up now. If anyone has any questions, I'll hang around for a few minutes. If anyone's having any trouble, I'll just pop back in the chat and let me know if you're having any trouble getting to that payment link. I know it's a lot, and functional medicine and confronting your health takes a tremendous amount of courage. It's we much rather stick our head in the sand and say, no, it's just going to go away on its own. So I'm just going to call upon you to kind of get that courage to confront your health. It'll make the difference in your lineage. It'll make the difference in how you age. It'll make the difference in how long you get to spend with your family, how long you get to stay here on this earth with a life of health. Modern medicine will keep you alive for a very long time, feeling very lousy often. Functional medicine will keep you alive for a long time, feeling healthy. So that's what we're going for now, health span. The more we learn, the better we get. And this really is the best for you. So I want to thank you for your time. Okay, so genusphysicalhealth.com if you need to check out the website. You all have a connection because you signed up here. You can reach back out if you need anything else. And I look forward to meeting each one of you, and I look forward to those calls. Okay, I'm going to end the meeting now. Have a wonderful, wonderful rest of your day.